Thank you for staying tuned. This is NTN Live. We're live from the studios of the Government Information Service. If you're just joining us, a special welcome to you. My name is Jessie Leonce, and I'm joined in studio by my colleague Carlton Cyril, delivering the Creole translations this morning. This is the Information Command Center as it regards to COVID-19, St. Lucia's response to this deadly virus. We are joined over the phone at this point by Dr. Carlene Radix, and she is the head of health at the Organization of Eastern Caribbean States. She'll be giving us a regional overview and update on the COVID-19 pandemic. A special good morning to you, Dr. Radix.
Hello, good morning, and thanks for having me.
Wonderful. All is well with you in terms of COVID-19? How are you keeping? How are you protecting yourself?
Well, like everyone else, I am social distancing, working from home. Our kids are at home, and along with the team from OECS, we're working with distance, but to help fight against COVID-19.
Wonderful. Can you just give us a regional overview of the COVID-19 pandemic in terms of each member state's approach up to this point?
Well, let me give you a sort of overall overview. I think now is a good time for us to step back and look at what's been happening over the last few weeks. If you look at the last 4 weeks of this pandemic within the OECS region. 4 weeks ago, we had a total of about 62 cases in the OECS member states, of which the majority of those cases were in the French-speaking Martinique and Guadeloupe, 57 cases. We had 5 cases in our English-speaking islands. Compare that to today, where we have now 113 cases within our English-speaking islands and a total of 306 cases combined in Martinique and Guadeloupe. So I think it's important to note that there has been, although our numbers are small in each of our individual member states, it's important to look back and to see how this is unfolding. Luckily, the number of casualties have been small. To date, we have only had a total of 18 deaths, of which 16 have occurred in Martinique and Guadeloupe, who they've been dealing with the bigger numbers. So I say all of this to say that certainly the measures that were taken several weeks ago and that we continue to take are slowing the progression of the disease within our countries, but the disease, as it has to, is continuing to progress. What our behavior is doing is allowing us to control how that progresses and progress in a way in which we protect the most vulnerable, the persons who are likely to have the most severe outcomes of this disease, and in a way in which the numbers do not overwhelm our health systems and allows our health systems to prepare and to respond.
Okay. Any new developments on the part of OECS in terms of resource mobilization and procurement?
Yes, as we've been reporting, we've certainly been engaging widely the private sector, our global partners, development partners, and certainly the ministries and governments of the OECS member states have been working together. On the private sector front, we have had Digicel join our partnership in the fight against COVID-19, specifically giving funds towards personal protective equipment that we're procuring from member states. We've had some support from the Global Fund in redirection of funds towards lab testing and supplies. We've been working in partnership with other agencies to redirect funds, and so the fight continues. As we had mentioned before, regional organizations and local organizations such as Massey Stores, Republic Bank, Sagicor, Bank of St. Lucia, and Intellect have already joined and are helping to support our resource mobilization.
In the region, I mean, we saw cases abroad and here in the other member states, persons, really cramping supermarkets, trying to get food supplies and so on upon the announcement of partial shutdowns, national shutdowns, curfews and so on. The prime ministers have had to assure their populations that we are safe in terms of food and there's no need to panic. Can you speak on OECS's position on food security right now in the region?
Thank you for bringing that subject up. And certainly, I think it's important. I think that message is important. Certainly, when stores reopen, persons flock, and we have this crowding, which is dangerous for us in terms of the progression of the virus. I'm happy to see when I've been moving around in St. Lucia over the last couple of days that people have been following the social distancing measures and the measures being put out by the ministries of health. And so just to reinforce that we need to continue to have the discipline to follow the measures so that we can prevent the spread. But with regards to food security, a joint statement was put out between the OECS and Healthy Caribbean Coalition, another one of our partners. The Healthy Caribbean Coalition is a coalition of civil society organizations that look at chronic diseases such as diabetes, hypertension, cancer, etc. And as we all know, these are the persons who are most at risk for severe outcomes from COVID-19. And keeping them healthy is also about keeping healthy diets. So in addition to making sure food is available, making sure that nutritious food is available is a big part of our response to COVID-19. The OECS agricultural sector, the ministries of agriculture have looked at a response plan for COVID-19. St. Vincent and the Grenadines has led the way with having a clear plan that they've put into action. And at the same time, we're encouraging the general public and all sectors of society to support use of local agriculture for healthy, nutritious meals in this time.
What is the input of the OECS in terms of our vulnerable populations?
So one important part of our role regionally is to ensure that no one is left behind. And in this COVID-19 crisis, there are several vulnerable groups. Certainly groups who are on the brink into economically. There are socially disadvantaged groups, persons with disabilities, and of course persons with chronic diseases. These are all vulnerable groups in this COVID-19 crisis. And our ministries and governments have been looking critically at the situation and trying to ensure that they put things in place to respond appropriately. Some of the things we're doing is working with development partners such as UNICEF and ILO to help member states increase their existing social protection programs to ensure that persons who may now be falling below the line are included and can access social protection measures. This is alongside much of the economic stimulus packages and decisions being made across the region.
Well, thank you very much for your time, Dr. Carlene Radix, the Head of Health at the Organization of Eastern Caribbean States. Any final words?
Just to say, as always, we encourage everyone to continue to follow the public health measures being put out by your ministries of health. Together, we can control the way in which this virus spreads. We can protect the most vulnerable. We can make sure we have nutritious meals, and it takes an all-of-society approach. So everyone, hands in, one community. Together, we must.
Thank you very much for that call-in. Do enjoy the rest of your day, Dr. Radix.
Okay, you too.
Bye-bye. That was Dr. Carlene Radix, the head of health at the OECS, just giving us an update in terms of the regional overview of the COVID-19 response, new developments in resource mobilization and procurement from the OECS, as well as food security in the OECS region, and the input of OECS on the status of our vulnerable in society. Carlton?
Merci Anchai, Jesse, merci pour vous qui continuez à écouter, qui là et puis nous. Vous voyez ça, dans un moment là, nous avons parlé avec Dr. Carlene Radix, c'est lui qui est tête responsable là venu pour ces pays OECS nous. Nous avons parlé cette ici Dominique Séversin, ces pays ça. Vous voyez ça, qu'on rien c'est moun ça qui ni pour un plan by ces pays là il ban yon de information là les vini de sous observer en 4 semaines nous ni à présent semaine 4 semaines ça pour à présent la tenue est 62 cas les vini pour moun qui déjà contacté vers COVID-19 qui doit veiller pour à présent nous ni 113 et on va parler de ces pays OECS là et déjà au cas où qui manière bagay ça ka argumenter quoi les vini pour moun qui a mort et donc nous ni 18 moun a mort encore entre ces pays OECS là ça il dit là ou bien vrai ça ka mouche date qui en chay bagay ce gouvernement mettait en place ka travail mais il était bien clair pour dire ça pas veut dire nous j'arrivé et ben vers maintenant parlant encore et ben nous a détruit vers maintenant il dit tout ça qui était mis en place par ce bureau qui est responsable pour santé en ces pays il mouche il ka travail yon manière et ben l'autre mais il poko doubout vers maintenant sous question de qui manière bagaille en parmi ces gouvernements ces pays ça il dit yo ka clair l'année moun yo ja vinn ensemble et puis pour travail et puis yo qui a bayo l'argent yon manière ben l'autre a bay support ils ont maintenant Digicel par exemple et de Digicel a bayo l'argent qui ka aller acheter en chaque équipement yo besoin pour moun qui ka goumen combattre F20 maintenant équipement pour protéger quoi yo gloves masque overall et puis différents bagages aussi l'ont maintenant secteur privé et des local EV banque Saint-Lucie Banque Saint Lucia ici à Sajiko il dit ni régional et puis local ces compagnies ça ces banques ça c'est moun ça a venu pour assister nous ka parler assistance nous ka parler dire c'est pas pour pièce yon pays yo ka parler dire mais tous ces pays ensemble sécurité et manger c'est une autre question mais Jessie te vle demander parce que nous moun ka fait toute course moun ka goumen yon a l'autre bon c'est supermarket là question dit ça te demandé délai qui dit là vini pour ça il bien content question te demandé mais ce pays a pas gouvernement yo avec ce bureau qui est responsable pour santé et puis agriculture il dit yo having ensemble avec hani en plan de service par exemple ha mette plan déjà qui a dit ça yo ka prend en considération nous ni en chay moun qui vulnérable parmi nous yo ka katile yo concerné dit c'est moun ça pour raison ça il dit c'est moun ça nous ni pour changer moun qui est ni sick moun qui pas fort qui vieux kagoume puis yon disease et ben l'autre ben qui malade c'est moun ça nous ni pour faire assis oui yo manger bien yo manger assez manger kay tien yo en santé pour raison ça département yo ka venir plan yo veut supporter c'est les vini pour nous ka supporter local parmi tout ces pays qui a parlé yon a c'est encouragement yo ka bay yon a c'est conseil là yo ni c'est là vini pour moun commencer ka katile pour supporter ça ou ka planter pour supporter ça qui sorti là même en Saint-Lucie et ben souvent Dominique et ben c'est versant nous ni pour commencer à manger cabré local et plus bon pour nous à soupli passer yon raison. Mais il dit à part de ça, il y a un 6 points qui a travaillé puis l'autre organisation, il parlait de UNICEF, c'est organisation ça qui c'est international, il a parlé et puis c'est mon sec travailler puis pour faire assurer les nous combattre, nous a fait et puis toutes ressources nous ni. En dernière parole, mademoiselle Jessie m'a dit qui dernière parole il dit nous les vini pour ces bureaux qui sont responsables pour santé en ces différents pays il a encouragé moun pour coûter avertissement coûter toute information qui a bail et suivre information monsieur il dit pièce yon moun pas ni réponse là nous tous ni pour travailler ensemble pour faire assurer nous combattre et nous détruire vermine COVID-19.
Thank you very much, Carlton, for that. With that, we come to the final seconds of our program this morning. You have been listening to our morning report, our response report, COVID-19 response report on several updates we've had for the morning, presentations made by business entities to the government of St. Lucia to go toward the COVID-19 effort, the COVID-19 cause here on island. Monies going towards the social stabilization plans and national meals program, as well as funds for the procurement of personal protective equipment for our frontliners. So we'd like to thank the entities making the presentations this morning, pledges that they would have made on Easter Sunday from the telethon, the COVID-19 response telethon. Also this morning we had quite a few press releases coming out, a reminder of the St. Lucia Solid Waste Management Authority's a word on the collection of solid waste. We just want you to keep informed as much as possible. Not only will we have live broadcast, but we're having rebroadcasts of things that are happening. So if you stay tuned to NTN, you missed out on anything, then you can always stay tuned and get a chance to listen over to some of the important updates coming from the NTN, our GIS studios, NTN Live. This is the command center, the information command center for the COVID-19 response report. We encourage you to stay tuned. We have more programming coming up this morning. I believe we have the NCOPT president, National Council on Public Transportation President, Mr. Godfrey Ferdinand. He will be speaking to us around midday, and so we can look forward to that. He will be, of course, responding to the Prime Minister's announcement of the fuel rebate to the public transport drivers. That would be about $1 million given out to them in response to the COVID-19 situation. So we encourage you to stay tuned and do stay home as much as possible. If you don't have anywhere to go, really don't go for a lime. It's not worth it. Do stay in as much as possible as we try to flatten the curve. Dr. Radix said that there is a noticeable containment sort of COVID-19 in the member states, and we want to keep it that way. In St. Lucia, 15 cases, 11 have recovered, thanks much to the Ministry of Health, their efforts, their advisories to the public to stay home as much as possible. And for those who aren't, 30 people. The Royal St. Lucia Police Force has announced that 30 people have been arrested and charged so far for violating the curfew. Please do not risk a criminal record for staying out later than you should. There is a 10-hour curfew in place to protect you, to reduce the mobilization of persons up and down the city, up and down the country, to reduce and flatten the curve of transmission. 30 people arrested and charged, and persons being turned away at the zone checkpoints, the border checkpoints, because they have no business crossing into those zones. If you have no business, please stay home. Protect yourself and protect your family. Running out of time, thank you so much. My name is Jessie Leonce and Carlton Cyril in studio with me. Do stay tuned for more programming here on NTN.
Because of how quickly the coronavirus spreads, each new case